My name is Dr. Emily Boozalis. I'm originally from Houston, Texas. I did medical school at Johns Hopkins and residency at UCLA, where I served as chief resident. I am so glad to be a part of Ada West Dermatology because of the amazing colleagues that we have here. I became interested in dermatology in medical school because I actually had melanoma during medical school, and so that experience pushed me in the direction of dermatology. So we actually had a lecture during medical school on recognizing melanoma, and during that lecture, I was staring at the screen thinking like, gosh, I have a spot that looks just like that. So afterwards, I went and talked to the lecturer, and he diagnosed me with melanoma and did my surgery. And yeah, I just feel like this is a field where I can relate to patients a lot and have a lot of empathy for my patients. So yeah, that's kind of what pushed me into dermatology. I think the most important thing when looking for a dermatologist is somebody who is thorough and does things the right way and doesn't try to cut corners. The thing I find most rewarding about working here is the continuity with patients, getting to know people over time and seeing them back and learning about their lives and their families and what they like to do for fun. The most surprising case I think I had was during my training when I had a patient who had this horrible pyoderma gangrenosum, which is a pretty tough type of wound to treat that was brought on by cocaine use. So that was the first time I'd seen that. And then we actually went back and read about cases in the literature of those being tied together. Something I've learned on the job is it's more of the art of medicine that you weren't really taught in medical school or residency. Just finding people's comfort levels. If there's somebody who's a little bit more nervous, just bring them back in close follow-up. Those kind of things that make the visit more comfortable for the patient. My favorite piece of advice to give patients is to put sunscreen not just on the face, but on the face and neck, because there was this amazing photo case report that was published in the last couple years of a woman who used sunscreen just on her face and not her neck for 50 years. And her face looked ageless, and then she had a very sun-damaged neck. So I like to tell patients that. My favorite cosmetic advice to give patients, depending on how conservative or aggressive you want to be, I usually tell people to start with a broad spectrum mineral sunscreen, SPF 30 or higher, in the morning, and then a retinoid at night, like tretinoin. That's kind of a good place to start. And then after that, patients usually head towards Botox, and we can discuss filler after that, depending on your level of comfort and what you're interested in doing. So the best sunscreen is the one that you actually use. In general, dermatologists prefer mineral sunscreen because it stays on the surface of your skin and reflects UV light, so it doesn't actually absorb into your bloodstream. It's a little bit safer for the environment as well. But with that being said, if you're very fair and you have a strong history of skin cancer, whatever sunscreen you'll actually put on is the best. I like Ulta-MD. I feel like it's a good price point. It's kind of middle range price point, and it blends in really well. So that's what I wear. I have a pretty basic skincare routine. I do sunscreen in the morning, tretinoin at night, and then Botox just to prevent wrinkles. This is my first time living somewhere with 4 seasons, and so it's really been nice getting to experience fall and all the changing colors. What's different about this area compared to other places I've lived is just the people. Everyone's so nice and easygoing. I keep telling patients that they can complain more if they want. Not used to it. I have too many hobbies. We love rock climbing, so we go outdoors a lot when the weather's nice, and I also like watercolor painting, and I've gotten into wheel throwing, pottery lately, so too many hobbies. I balance my professional and personal life with a lot of help from our village. We have a baby, 10-month-old baby at home, and so thankfully we have a lot of help from parents coming into town and just friends and family. We're very, very fortunate. If I could talk to myself at age 15, I would just say that, everything changes, and the things that are so important to you at a certain time in life, different things are important to you later. Circumstances change, so yeah, just kind of letting go of things and keep moving forward. The biggest challenge I probably have had to overcome was probably having melanoma during medical school. It was just a very stressful time, and I wasn't a doctor yet. I hadn't graduated. I didn't really know what to expect. Yeah, it was really tough, and I was also trying to study. But I think out of that experience, I've become very, type A and about helping my patients, and I follow all of the cancer guidelines very, very closely, and I understand and can empathize with my patients because of it. So I think ultimately there was a big silver lining on that experience. Yeah, the best advice I got when moving to Idaho was to change my license plates. It's so funny. So I'm from Texas, and I moved from Texas to California to do my residency training. And everyone in California said, change your license plates because you have a Texas plate. Then I moved from California to Idaho, and everyone said, change your license plates. So, we're living in the same country. It's, they're all good places.